I've been in this place since 2004. The way, with all due respect, the way the Conservative Party is comporting themselves is equivalent to out-of-control frat house. Listen to the things they're yelling, right? It is deplorable. You know, the homophobic nonsense being thrown around yesterday, and, you know, we're just supposed to every day deal with this frat house nonsense. As I said, it's like they're taking the strategy from the movie Mean Girls.
Health Minister Mark Holland there answering questions on the tense tone in the House of Commons as his minority government faces successive non-confidence vote. Here's just a taste of some of that tension this week.
The Prime Minister go and inspect this palace in the sky on his recent trip to New York.
The Right Honourable Prime Minister.
Mr. Speaker, engaging with international leaders on fighting climate change, on solving global crises, on standing up unequivocally for Ukraine. Mr. Speaker, don't worry, on this side of the House, we're used to casual homophobic comments from the other side of the House.
And I'm going to ask the Honourable Member, please, to withdraw that comment.
Standing up to bullies requires us to call them out on their crap sometimes, and that's what I will do.
And Mark Holland is the federal health minister. Hi, Minister Holland. Good to see you. Thanks for coming into studio.
Thanks for having me, Pasha.
I have a number of questions about the announcement you made on autism and an national autism strategy in a moment. If you'll permit me, I wanted to start off on what I think it's a political show, and you know what's going on the Hill. And you used to be House Leader, and I heard you answer some questions today about the ultimatum issued by the Bloc. And the way in which I interpreted your answer was kind of like, this party and other opposition parties are playing politics. We're here in government trying to get things done for Canadians. And I'm wondering if you can concede that other parties might actually want to go to an election because they feel that you actually aren't doing stuff or getting stuff done for Canadians.
Yeah, well, I mean, it's not a surprise. I mean, opposition parties oppose and want another government in place, namely themselves. So there's no news in that. I think the point that I think we need to reflect on is what people voted for in 2021. People voted for a minority government. They voted for it eyes wide open. They returned an exact parliament that had been there previously, and they said, you guys got to figure this out. We don't have a consensus on one party. We need you to get to the table and find solutions. And so I think that's, as I walk around, I'm running into people who are very partisan who want an election, but when I talk to like normal human beings who are just going about their day-to-day life, they're concerned about affordability, they're concerned about, you know, they're concerned about the state of the world and climate change and healthcare, big time. And they want to know what I'm doing. And so that's more my point, is that as a parliament, I think we should be focused on solutions. And what I'm hearing is it's a lot of braying and sort of politicking. And there's going to be a time for that. Like, let's not forget, we're in a democracy. Elections are happening. My argument would be that they should happen every 4 years, that we should be finding a way when people elect a legislative body, we should be finding a way for that legislative body to work together on behalf of Canadians in the time that we have. My first term was 18 months. That doesn't serve anybody. You know, I think we need to find a way to create more stability, and that was part of what the Supply and Confidence Agreement was all about.
But ultimately, that agreement now no longer exists.
Sure.
And Canadians did elect a minority government. They didn't elect you to a majority government. And when you point to 2021 and the things that they wanted fixed, a lot has happened in the interim in which they might feel, and polling bears this out, quite a bit worse about the circumstances that surround them and the lot that they face in life, the affordability crisis, a whole bunch of things, even under your portfolio, the fact that they don't have a family doctor. Many more Canadians don't have a family doctor now than they did back in 2021. Again, isn't it understandable that they would want, at this point in time, the opportunity to see a change in government and see that new set of circumstances better addressed?
Well, sure. I mean, if you're an opposition party, you want to pull us down just as the dawn is rising, right?
But not just opposition parties, Canadians.
No, but Canadians, look, one of the reasons we have elections every 4 years, not just when there's a low point. You don't say when things get tough in the world, let's have an election. You say that we have them every 4 years so that you can detach yourself from the ups and downs of the world, and you can fairly evaluate whether or not a government delivered. Look, there's no incumbent government anywhere in the world where that isn't facing these issues. These are very, very challenging times. And as I say, the answer is to be focused on solutions. Now, to be clear, they're not our solutions. We have to find partners in Parliament. And if we can't find partners in Parliament, Parliament will fail. But I think the people cheering for Parliament to fail, the people cheering for solutions not to be found, are people who are only interested in their egoic partisan interest. There's going to be an election.
But what if they just don't think your solutions are the right ones?
Well,
and that they feel that because...
They'll have an election.
But they could have one right... I don't understand what's so inherently wrong about wanting one sooner rather than later.
I guess I have an instinct, and certainly it was reinforced by what happened in 2021. The Canadians want a Parliament that functions and works, and that they don't want bonus elections because people aren't able to figure it out. You know, there is definitely a massive chasm between... I don't even know what the Conservatives stand for, right? I mean, they got a lot of slogans. They have no substance. They have no policy. They have no ideas. So they're going to change to what? I have no idea. I mean, I guess they say they're going to say at some point in time. But the Bloc and the NDP are consistently putting ideas on the table and things they want to do. And I think it's the job of Parliament to take a look at that. Is there commonality in the values we share and the things that we want to do? And, you know, we've got huge things done. I want to take a moment. 750,000 people. It's actually now over 780,000 people got dental care. Pharmacare, we're ready to deliver on making sure people get the drugs they need. You know, that's diabetes drugs. That is contraceptives. People need those drugs. Those are things this Parliament can deliver for people to really materially improve their lives. Yes, times are hard in the world. There's no question about that. No one would have an argument. It's a difficult time to be a human being. The question is, are you just making people angry about what's broken and what's not working in the world? Or are you offering solutions about how Canada can continue to lead? Because in a relative situation, Canada's doing very, very well. Canada's continues to be the best country in the world, Vassy. And I'll tell you what, it's because we continually focus on solutions. Now, it doesn't mean it's great right now, because it's not great anywhere. But and it doesn't sound very good.
That abdicates your government from all responsibility. I take your point on the gaps in what the Conservatives have put forward, but when you say dental care and pharmacare, they are critical of the amount of money that has been invested in those programs. You obviously feel there's value for that money. They take a different view, and they say that they would spend money in different ways or cut back on money.
No, but it's not me who thinks that these programs have value. Go talk to a senior who had the same pair of dentures in their mouth for 40 years, down to plastic plates in their mouth, pain with every bite they have. Now they have a smile they can be proud of. To me, that's fundamentally Canadian. That's about that person and about me. A diabetes patient, I'm meeting a doctor who says, why am I even meeting these patients? I can't give them the medication they need to stay healthy. Diabetes costs us $30 billion a year in this country. What is Poilievre's solution for the people who can't get access to medication? People who haven't been able to get access to dental care? Too bad. You're on your own.
Well,
that's not a solution.
That's not exactly what he said.
We have two other political parties who, by the way, represent more than 60% of the people who voted in Canada who say they want to stay talking about solutions. So why should the Conservative Party alone, who never believed in us, don't believe in anything we're doing and have opposed values to us, why should they, with 30-something% of the vote, be able to dictate when an election happens and on what terms they have? But
that's the way our system works. If
no, it doesn't. No, the Conservatives don't. We have to work with other parties.
Ultimately, if the Conservatives find other people to work with them to defeat your government, that is the way that
but they just
the
moved
system works.
And
just to be fair to them.
They moved to non-confidence votes yesterday.
Yeah.
Then they're moving another one today.
But you provided them with that opportunity to do it.
We provided them with an opposition day motion. And you know what you could do with an opposition day motion, Vassy?
And they have in the past.
You could present an idea how to improve the country.
Okay, they have in the past. I mean, Liberals also. I remember covering a minority parliament in which Liberals were also working to defeat Stephen Harper's government at any opportunity. That's what opposition parties do. And I just want to get back to, and I take your point again about the gaps in their policy. There are many. But when you say, he's going to remove, he said the other day in the House of Commons during that non-confidence motion that he would hope to take money from one place and increase healthcare transfers to provinces, increase healthcare spending in another degree. I'm just saying it's not just the way they say everything's your fault is not true. Everything that you say that there's absolutely nothing they've put in the window is also not true. And on the point of culpability,
look, you can talk to me and I would welcome it. Every element of our health system, and you know how complicated our health system is, and I can give you detailed policy answers of what we're trying to do in every single area. What you just said, let's just examine it. The Conservatives have said that they're going to eliminate the deficit, which means massive, massive cuts. And then they say they're also going to find money to do something in healthcare? Like, what is your plan to do those two things?
I get it.
So
Believe me,
I've
asked those questions many times.
So all
Your
I'm
party
saying,
has
Vassy,
used my questions about dental care.
All I'm saying is that what the standard I think would be fair to hold me to, and obviously, you do it however you want, is what are you trying to do to improve things for Canadians? How are you trying to work with other parties? Whether or not as a health minister or as House Leader, or whether or not it's with my other colleagues doing the same thing, we're trying to find common ground. I don't think the job of a government or a parliament is to divide people or find ways that things don't work. I think we're supposed to understand each other. We're not supposed to go in there and amplify the differences that exist in the country.
But you both do.
We're supposed to be finding solutions. I would argue to you, and you can hold it. You watch Question Period. You watch the way they comport themselves on the other side. You take a look at the way that we try to find solutions. You take the way that we try to find common ground and work with other parties that are different than us. They don't do that, with all due respect. The way they talk, the way they attack, the way that the kind of nonsense they're yelling on the other side, the kind of frat culture over there, they're not, who are they trying to work with? Like, we're legitimately trying to work with parties that have different ideas with it. That's hard work. Working with the NDP, I disagree with them on so much. It's hard work to find common ground. The Bloc, I've got massive differences with the Bloc. I mean, huge differences, but trying to find common ground because people elected them and I'm trying to respect them. I don't see that same respect from the Conservatives. I don't see respect for democracy. I don't see respect for other parties. I don't see respect for other opinions.
And I take your point on all that, but with great respect, does your party have respect for the voters? You've spent a long time here telling us how Canada is great and good, and there are ills in the rest of the world that all incumbent governments are facing. I've heard this consistently from yourself, from other ministers, from the Prime Minister on Stephen Colbert, who said, yeah, Canadians are frustrated and they're taking it out on me. Why is there no line of culpability whatsoever? You promised in your portfolio specifically in 2019, not you, but your predecessor, that every Canadian, the Liberals would fulfill a promise where every Canadian gets a family doctor. And instead, there were 14% of Canadians who didn't have one in that year, and there are more than 20% now that do. It's not always everybody else's fault. I take your points on the criticism.
I've never said that.
But that's what you and your colleagues are inferring.
In fairness, no, that's not true. That's just factually not true. And I'll tell you exactly why it's not true.
It's bad everywhere else, is what you said.
No, what I've said is that it's bad everywhere else, and we're working hard to find solutions. If you are going to tell me that I'm not somebody focused on solutions, name the area of healthcare, I can tell you the very specific and direct things that we're doing to make it better.
Are they working? Do people feel they're working?
Absolutely they are. Coming out of COVID, there isn't a health system in the world that wasn't straining under the weight of COVID. There isn't a health system in the world that didn't have huge backlogs and challenges. And we absolutely have made massive progress. The bilateral agreements that we've signed with every province, every territory, the $200 billion that we're putting forward with common indicators.
Fault, but people in provinces don't feel like things are better than they were a year ago in healthcare.
You want positive proof points? People getting care. You want positive proof points? Agreements being signed with common indicators so that provinces can be held to account for that progress. Now, we're not going to get there overnight. You can't snap your fingers, and you should be afraid of anybody who says you're going to. It requires slow, methodical, inch-by-inch work to make progress happen, and that's what we're doing. And I understand. It's never fast enough. I've
been here for 9 years with great respect.
Absolutely. And look at how much progress has been made. Childcare, $10 a day childcare everywhere in the country. The fact that we've got the ability now to be able to be addressing climate change in a real way, seeing for the first time emissions coming down when the economy is not coming down. We're on track to meet our targets. This stuff is huge. This is stuff that didn't happen before.
Not say that.
But I would say to you that look, holding me to the standard of the world that I'm not doing it good enough, I agree with you. And I'm going to wake up every morning, I'm going to try to do better. But I'm going to say to you that at the same time, if you're going to judge me against perfection, then hold the others to the same standard and ask them exactly and specifically how they'll make those things better. Let's talk about the toxic drug supply and the absolute lies they tell and the damage of those lies and how they misrepresent that situation.
When they agree to come back on this network, I will, and I have.
And let me tell you,
job is to ask
let me tell you, the existential threat to our health system is Pierre Poilievre. What he would do to our healthcare system, not just to cut dental care, not just to cut pharmacare, but the devastating cuts he's going to have to make across the board to do even a part of the things that he says he's going to do is going to have a devastating effect.
Cut healthcare, and I take your point. I've asked him a million times. But
what's the plan? He says on the one hand, look, I'm going to give everybody everything they want. Don't worry, every problem is going to be fixed. You got a problem? Here's a slogan. You got a problem? Here's a slogan. It's all going to be fixed. What's the path? What's the work? And guess what? It's not there. It's a bunch of smoke. It's a bunch of mirrors, and behind it is vacuous nonsense. And I'm saying
and
that what
they're
we're
polling
offering
20 points ahead of you and have been for 8 months.
Of course, because they're doing a very good job of amplifying people's fears. You know, what they do is they pour poison and vitriol into the system and can try to convince everybody that everything's terrible instead of looking people in the eye and be straight about what's hard and what's difficult and what has to be done to make it better.
Scapegoat for your party? Maybe people really feel that way.
Vassy, I don't know if you encounter this in your life. I encounter it all the time. There are people who complain and say things are broken, and there are people who try to actually make the world better and do things. And I would say to you that if they want to prove that they're the second group of people, and by the way, that's what an election is about, because it's very easy to complain, very easy to say what's broken. But if you want to get the opportunity to go and make change and do something different, you have to show how you're going to fight for every inch of progress, what you're going to do every morning, what kind of character you have to do it. That's a question that I welcome. But I welcome it at a time when we have a normal election. In my opinion, having an election because the Conservatives won an election isn't a good reason for one. We have a democracy. We have 4-year terms.
Okay.
During that period of time, it's essential we use that time to get things done.
I do want to, as promised, because I've taken a lot of your time, ask you a question about the National Autism Strategy that you announced today. The main criticism we've heard from the groups that we spoke to today was that they wanted to know there would be resources attached when it is deployed. You had some money attached in Budget 2021 to the development of it. Are you going to put any money behind the actual deployment of it?
Yeah, it's a totally fair criticism. I think that what I said when I announced it today is this is an essential first step. It gives us a map, it gives us a compass, it shows us the way forward to make sure that people the people who are autistic have the opportunity to have their full potential realized and their families are supported. But it's just the beginning. And yes, absolutely, these are conversations we have that now, okay, how do we actually actualize this? How do we incorporate it into our national housing plan? How do we work with provinces and territories for them to do their part? So that's the next beat on this. But I think one of the things that's so important here is it gives us a roadmap and a way forward. And I really want to commend Mike Lake for a minute. Mike Lake, who's conservative member of Parliament, who's been fantastic on this and a remarkable advocate, and I've learned so much from him. And I would say that kind of the way that Mike is working in this space, and we're working with Mike, that's the kind of Parliament I want. And that's kind of what I was getting to, what I was talking to before. I think it's what Canadians want. I think they want us to say, hey, where do we agree in this 4 years? Where can we find common ground? Where can we get things done? That's what we're doing in autism. And I was really proud to do that. And I was really proud to work with Mike Lake on that.
I'll very quickly say that you didn't answer the specific question. Will there be money attached to this?
Sure. I mean, that's what I'm saying is we're working at incorporating it in. And that's something that's work to be done. And I acknowledge that work must be done. And so there is work to be done and absolutely acknowledge that.
I'll leave it there. Minister, thanks for all your time today. I appreciate it.
Thanks, Vassy.